right.
All right. Hey, everybody. This is Christian with Dr. Devin here, and I like to ask the question, why the wellness way? Clearly, you had other options. You had other choices. Why did you choose this?
Yeah, so I had choices. Like I was supposed to go back to North Dakota, take over basically my doc, who I grew up seeing.
Wow.
I was supposed to take over his office, and I ended up experiencing the wellness way, actually going through more as a patient when I first started, but also experiencing it through school. But the reason I truly joined the wellness way is because it bridged the gap to what we were taught in school. We were taught the 3 T's: traumas,
right.
toxins, and thoughts. School focused so much on the trauma, so the adjustment side of chiropractic. But throughout history, we've kind of lost our way when it comes to focusing on the toxins and the thoughts. And that's where the wellness way really bridged that gap. Wellness way really started to hit on why the toxins and thoughts could also be causing problems, because we see it all the time. People get adjusted all the time, and some people see great results.
Right.
Some people don't. And then those people who don't get great results are like, oh, the adjustment doesn't work. And it's like, well, it's because you weren't dealing with the trauma aspects of those 3 different stressors. We talked about the traumas, toxins, and thoughts. Where the wellness way really helped me start to address the toxins and thoughts, because we live in a toxic world. We live in an area where people think so negatively about each other. We don't just face traumas too, guys. We have to get that perfect 360 degrees of care, and it just helped me bridge that gap between my patient care and some of the results I could see. Was it just gave me that complete view on a person's body and allowed me to address every issue, and gave me a way to treat the patients too that school tells you, oh, you got to refer out for that. Send them to the real doctors, like my type 2 diabetic patients, my patients that have Alzheimer's, dementia, cancer patients. It gives us a way to help support their body while also working with the medical doctor if needed, but I don't have to just refer out every single patient that they don't need an adjustment.
Awesome. And where's your practice?
I'm in Pensacola, Florida, and also in Atlanta, Georgia. So I have 2 practices right now. Soon it will be just one once I get someone hired in Pensacola, but so I'm running 2 offices at the moment. Hopefully it'll just be one, because I don't recommend the 2 offices at once for anyone.
That's hard, isn't it?
Oh yeah, it's definitely hard. It's a lot of traveling. I mean, driving 5 hours twice a week, spending 2 days in Pensacola, and then having another 5 in Atlanta.
Well, maybe there's somebody out there that would be excited to help you.
Yeah, for sure.
All right, thank you.
Yep.